Hi guys, welcome back to another video. So in today's video I want to address something else that's very important to the pregnant community, and please do not ignore this video because what I'm going to talk about in this video can mean life or death for you or your baby or both of you. So it's very important for the pregnant community to watch this video. So in today's video I am talking about danger signs in pregnancy. Danger signs. Even the word, it just tells you that if you see any of these things, then something is definitely wrong or you need to act fast. Okay, so that's what we're talking about, and I'm going to be telling you about 6 danger signs in pregnancy that you need to look out for and act really fast if you see any of them happening. Okay, the first one is excessive headaches. Number 2, severe abdominal pain. Number 3, vaginal bleeding. Number 4, rupture of membranes. Number 5, decreased or absent fetal movements. And number 6, excessive nausea and vomiting. So in this video I'm going to talk a bit more about each of these things, so stay tuned. So the first thing, excessive headaches. Guys, it is not normal to continuously be having headaches in pregnancy. If you are experiencing a lot of headaches, usually there's something wrong, and there's quite a few things that can be happening if you're experiencing excessive headaches. One of the things that can be happening if you are having like a lot of headaches is you might be anemic and your blood is very low, and now that your body has to share your blood with your baby, it leaves you at a deficit, and then that makes you constantly feel tired and fatigued and can give you headaches because now your brain is not getting enough oxygen and it's not getting enough blood. Then you might have those headaches if your HB is low and you are anemic. You might also be having headaches because you are dehydrated, you're not drinking enough fluids, and now because your body has to create a higher volume of your blood to cater for you and your baby, then it leaves you dehydrated, and again less blood is getting to your brain, and then you experience like a lot of headaches. Or you might be having headaches because you are hungry, your sugar is very low, maybe you've been vomiting a lot. Or you might be having a headache because you're not well rested and you sleep deprived. So those are the things that can cause you to have a headache. But then there's another one that is very, very important and quite more serious than all the other ones, is if you are having a headache because your blood pressure is very high. Okay, so high blood pressure is something that is very dangerous in pregnancy, and that's why you need to continuously be attending your antenatal visits to check, is your blood pressure okay? Okay, because if you have high blood pressure and you have a condition called preeclampsia, that can put your baby at risk. You literally can lose your baby, or you can even lose your life if your blood pressure is too high during pregnancy. So that's why it's so important to ensure that you have a good blood pressure. So if you are having a headache, you can make sure that you drink lots of fluids, make sure you've had a meal. You can try and sleep it off a bit and see if it doesn't go away. But if you are having excessive headaches, guys, that are persistent, they don't go away, even if you've done the things that I've mentioned, it's better to go and get things checked out with your healthcare provider. Then the second thing that I want to mention that is a danger sign in pregnancy, it's excessive and severe lower abdominal pain. Lower abdominal pain, that's like your period pains, but period pains that are getting like quite severe and getting closer together. Okay, so when you are pregnant, you might be having aches and pains everywhere in your body, and you might also have things called Braxton Hicks, which are false labor contractions. And Braxton Hicks contractions are very mild. They shouldn't be too painful. You should continue with your life as you have them, and they are very far apart. They don't have a pattern, and they're not coming close together. But with this excessive abdominal pain that I want you to look out for, this is the one that feels like period pains. As time goes, it's getting increasingly painful and you cannot continue doing your activities, and this pain is coming closer and closer together. So it's developing a pattern. If your abdominal pain is like that, then probably it is labor. And it might be, if it's early in your pregnancy, you're having a miscarriage, or if it is like closer to the time that you're going to give birth but you're not yet 9 months, it might be that you're going to be having preterm labor. So also very important, don't sit with low abdominal pain or contractions for too long. If you're getting contractions that have a pattern, it's better to go and get them checked out. Then another thing, the third thing is bleeding. Vaginal bleeding in pregnancy, it's never a good sign. Okay, after you realize that you're pregnant, you might have a implantation bleed. That one, it happens for most people, and it usually happens 2 weeks after you've conceived. So that's not the one that we are talking about. The kind of bleeding that I'm talking about is if maybe you are 8 weeks pregnant and then you start to see like constant spotting. That does not go away. Sometimes you might have some spotting. Maybe after you've had sex, you realize there's some sort of like spotting when you wipe yourself, and that could be due to an infection, which you also do need to get checked out. So if you do see any spotting, could be an infection, and could be because you've had sex and the sex is stimulating your cervix. So rather just go and get it checked out, guys. Whenever you see blood, go and get it checked out. So sometimes you will have that bleeding maybe after sex, or just even if you haven't had sex, you just see the bleeding when you wipe, and then it goes away. But if you see it again, anything that is persistent or anything that is constant in pregnancy is never a good sign. So get it checked out. If you're having spotting or bleeding, get it checked out with your gynae or your midwife. That is a danger sign. And then another thing that I want to mention, it's rupturing of your waters. If you see your waters rupture, that is a danger sign. Go immediately to your hospital. Go to see your gynae, go to see your midwife. That means that you are about to give birth. If your waters break, it means you are about to give birth. Even if you don't have contractions and your waters just break, go to the hospital ASAP. That is very, very important. If your waters break, your baby is losing that protective cushioning that surrounds your baby in the uterus. So when there's no water, then it puts your baby at risk for a lot of things, and for infection that might go from the vagina up into your uterus. So it's very important to get that checked out. And then another thing, decreased fetal movements. Guys, your baby is supposed to be moving throughout the whole day. Once your baby starts to move when you are pregnant, you will get to know your baby's movements. You will know that, okay, my baby moves a lot at night. During the day, my baby's a bit quiet, but my baby moves a lot during the night. You'll get to know your baby's pattern and your movements. You'll also know that if I drink something hot, my baby moves. If I drink something cold, my baby moves. Or if I eat something spicy, my baby moves. So get used to and know your baby's movements, so that when there's a change in your baby's movements, you are able to detect it immediately. And sometimes when you get to the 3rd trimester of pregnancy, because now the baby is big and there's not a lot of space in your uterus, the movements might decrease a bit. But even then, you still need to feel your baby kicking and moving each and every day. So, and the movements I'm talking about, guys, it's not the kind of movements when you are laying in bed and you turn to the left side and baby moves to the left side, or you turn to the right side, baby moves to the left side, to the right side. No, the movements I'm talking about, it's the kicks. When your baby is stretching, or when your baby is just moving the arms or the legs or the knees, those are the kind of movements that you need to feel. And if you don't feel the movements or they are decreased, it's better to always go and get it checked out, or contact your midwife or gynae and ask about it. And then lastly, what I want to talk about is excessive nausea and vomiting. Guys, I know some of you will experience nausea throughout the pregnancy. You will experience nausea throughout the pregnancy, and it might even get to the point where you need to change your diet completely. All right, and eat like bland foods, boil stuff. You might have to change your diet, and even have to change the way you cook food. Okay, or you might just have a very limited diet. But even then, excessive nausea and vomiting is not a good idea, because now if you're vomiting literally everything that you eat, you won't get energy. you're going to be dehydrated, and you not having energy and being dehydrated, it's never a good sign, because that means your baby is not going to get nutrients, your baby is not going to have enough blood, and the baby is going to be deprived. So very important, if you are having excessive nausea and vomiting, go and consult, because sometimes you need to get a drip just to help you regain your hydration. And then you can even get medication to stop the nausea or to stop you from vomiting. So very important to consult if you have this kind of thing. But if you are vomiting and you are nauseated by certain foods, then try and eat whatever it is that you can keep down. Even if you have to eat dry toast and drink tea and boil chicken and only put salt to season your chicken and just eat like bland food, then so be it. But we want to make sure that you at least eat and you are able to hydrate. So those are the danger signs that I wanted to talk about, guys. Please act very, very fast when you see these things happening. Speak to your gynae or your midwife. Or if you are in the public sector, usually when you have danger signs, you are supposed to go straight to the hospital. Okay, so please, let's do all of these things, guys, to protect our moms and our babies. We don't want our moms to end up giving birth to stillborn babies because they ignored signs that the baby was not okay. Maybe baby wasn't moving and mom thought, it's just okay. Next thing, when she goes and gets it checked, there's no fetal heartbeat. So please, guys, these things are very, very important. Let's look out for them and let's act fast when they do happen. I wish you guys happy pregnancies and healthy babies, and I'm gonna see you on my next video.